Dr. Watson puts on a rabbit mask, stands in front of a class, and a loud siren is played, causing the class to jump. Now, whenever Dr. Watson shows the class a bunny, the class jumps. The siren is considered a blank. First things first, we ask ourselves, what is the question asking? Well, the question is asking about the siren. And in the context of this question, we're looking at some sort of respondent conditioning. With respondent conditioning, what do we think of? We think of stimuli and we think of reflexes. Because with respondent conditionings, we're taking unconditioned stimuli, pairing them with neutral stimuli, and creating conditioned reflexes. So in this case, let's break down our scenario. Dr. Watson puts on a rabbit mask. This is going to be the unconditioned stimulus. The loud, or the neutral stimulus, I should say. The loud siren goes off, which is the unconditioned stimulus. The class jumping is the unconditioned reflex. Now, when Dr. Watson shows the class a bunny, the class jumps. The bunny has become the conditioned stimulus, and the class jumping has become the conditioned reflex. So again, quickly, to recap, rabbit mask was neutral stimulus, loud siren was unconditioned stimulus, class jumping, unconditioned reflex. Through pairing, the bunny becomes a conditioned stimulus, the class jumping is now a conditioned reflex. If you don't understand that order of operations, you need to go back and review respondent conditioning. Yes, we deal with operant behavior in ABA, but you do need to know about respondent conditioning and respondent behavior. So with that said, the question is asking about the siren. The siren is what? Well, we just went over it. The siren is going to be that unconditioned stimulus. It leads to that unconditioned reflex of jumping. Once you pair the siren and the rabbit mask, now we create conditioned stimuli leading to conditioned reflexes. Respondent behavior, make sure you understand it and understand how the conditioning process works. Blair is training for her dance recital. Her instructor wants to work on Blair's focus when there are distractions in the audience. Blair's instructor will play loud music and talk during Blair's rehearsal to distract her and will only stop when Blair completes her routine accurately. Blair's teacher is attempting what? What is the question asking? They're asking about Blair's intervention, Blair's teacher's intervention, her behavior, right? Now, notice the keyword attempting, because this is a reinforcement punishment question. How do we know for sure if a consequence is a reinforcer or a punishment? Well, we have to look at future behavior. Since we don't know Blair's future behavior, we don't know what the outcome of this intervention is, we can only assume, right, what Blair's teacher is trying to accomplish. So now we have to make a hypothesis giving the information. So let's review. Blair's instructor, Blair's teacher, wants to work on Blair's focus when there are distractions. So she starts to play loud music and talk during Blair's rehearsal and only stops when Blair completes her routine accurately. So she's trying to increase Blair's focus and increase Blair's ability to complete the routine accurately. She's removing the distractions when Blair completes the routine accurately. So if we're trying to increase the behavior by removing a stimuli, what are we trying to accomplish? We'll break it down. Positive is adding, negative is removing. So we know we're removing something here. We're removing the distraction. So we're looking at negative. And we're trying to increase Blair's focus, or more behaviorally, completing her routine accurately. So we're trying to reinforce. Removal, reinforce, negative reinforcement. Blair's teacher is attempting negative reinforcement. Fill in the blanks. A functional relation exists when a well-controlled experiment demonstrates that a specific change in the blank produced by a specific manipulation of a blank, and that change was unlikely to be the result of a blank. Okay. Chances are you won't get a fill in the blank question on the exam, but this is practice. We are just trying to, one, expand our fluency, okay, and expand our understanding. And questions about IVs and DVs and confounds are some of the most common questions I get. All right. When you're just learning about IVs and DVs and confounds, it can be a little tricky to understand what each one is and what purpose they serve in relation to functional relations, right? Because this is all experimental. In actual practice, in ABA practice and therapy practice, we don't talk too much in these terms, okay? But these are what we're actually manipulating. The behavior is typically our dependent variable. Our independent variables are typically our interventions, right? We're trying to control the behavior with our interventions. So we need to understand what is the dependent variable, what's the independent variable, what's the confounds. This short little sentence is going to give that information, right? So if we look at it, a functional relation, meaning there's control, exists when a well-controlled experiment demonstrates that a specific change in the blank. So what is changing? What is changing in our experiment? What is changing in our intervention? What is changing in our treatment? We're trying to change the dependent variable. The dependent variable is the one that should be changing, and the change is produced by a manipulation of what? Of the independent variable. Again, when we manipulate that independent variable, we are hoping to see a change in the dependent variable, right? We're not manipulating the DV. We are manipulating the independent variable, adding, taking away, in order to see a change in the dependent variable. In other words, I'm introducing my intervention, I'm manipulating my intervention in order to produce a change in the dependent variable. And that change was unlikely to be the result of what? Well, unlikely to be the result of a confounding variable. A confounding variable, of course, is a variable we don't control. It's an extraneous variable that we aren't controlling that's affecting our dependent variable. Confounds are threats to functional relations. So if we fill in this blank, it should read, a functional relation exists when a well-controlled experiment demonstrates a specific change in the dependent variable produced by a specific manipulation of an independent variable, and that change was unlikely to be the result of a confounding variable. Review it a few times. It takes a few times for this to stick, right? Just understand, we manipulate the independent variable to see a change in the dependent variable, and we try to control for extraneous variables and confounds. If we can do that, if we can prove our IV controls the DV, then we can say a functional relation exists. Which of the following answer choices are considered behavior according to radical behaviorism? Now be very careful here, right? On the surface, this is a very easy question, but you'd be surprised by how easy it is to forget what radical behaviorism actually is. Remember, when Skinner made radical behaviorism, he wanted to expand what we considered behavior, right? Not only public observable things, but Skinner said, what happens inside, what happens privately, that's also behavior. And we have to understand that and account for that. Now, can we measure and observe and manipulate it as well as external events? Well, of course not. In public events, no, right? But it's still behavior. So if we're looking at radical behaviorism, don't skip that word radical behaviorism, is very important. Is thinking a behavior? Absolutely. It's a private event, but we think in response to stimuli, right? We get SDs, consequences, our thinking is affected, it's changed. Thinking is behavior. What about feeling? Feeling is also behavior. Okay, it's internal, it's private. However, according to radical behaviorism, according to Skinner, feeling is also behavior. Eating is obviously a public event. It's obviously behavior, right? Eating is the most obvious one, but it's there to throw you off. Because you can read this quickly and say, well, thinking and feeling, we can't observe those. It's not behavior. Slow down, right? Because with radical behaviorism, private events are behavior, okay? We just don't focus on those in practice. So which of the following answer choices are considered behavior according to radical behaviorism? Well, it's going to be D, all the above. If we wanted to explain positive punishment to a parent, which of the following explanations would be best? Now remember, when you get a question about explaining something, what they're looking for is that you understand we don't use jargon, we don't use technical terms, we talk and explain things to parents in a way they can understand with no knowledge of ABA, right? You need to speak to the level of your audience. Now, if you have a parent who's an RBT, a lot of parents are now becoming RBTs to help their children, which is great. You can talk to them in a different level. But the majority of parents aren't going to understand what positive punishment is. Remember, punishment's a traditional technology. When people think of punishment, they think of a very specific thing like spankings, right? Bad consequences. And we know as analysts, all punishment means is we're decreasing something. So if we need to explain positive punishment, how are we going to do it? A, we're going to start adding and removing things to try and decrease the behavior. So it's a good explanation. It's simple, it's straight to the point, avoids jargon, but is positive punishment removing things to try and decrease the behavior? No, that would be negative punishment. We are explaining positive punishment, so be careful. B, we are going to take away one of your son's tokens each time he engages in protest of any kind in attempt to decrease the behavior. All right, again, are we talking about negative or positive punishment? We are talking about positive punishment. Taking away a token to decrease the behavior would be negative punishment. It's not what we're talking about. C, by removing a stimuli as a consequence of maladaptive behavior, we are working to decrease future instances and occurrences of certain behaviors and responses. All right, multiple things wrong with this. First, again, we're not talking negative punishment. We're not removing stimuli. We're adding stimuli. Second, it's too jargony. It's too technical. Removing a stimuli. Well, what's a stimuli? As a consequence, what's a consequence? Maladaptive behavior. What's maladaptive behaviors? On and on, right? Think about when I explain this, can they understand it simply, or are they going to have to ask a bunch of follow-up questions in response to my explanation? C is so jargony and technical, it's going to be very difficult to get on the same page as your audience. So it leaves us with D. We're going to start adding positive minutes to timeout, which will hopefully decrease punishment behavior. Perfect. We're explaining simply what we're doing. If you need to know what positive punishment is, well, we're going to start adding things. Hopefully, we're going to decrease the behavior. That's positive punishment. Which of the following explanations is best? D. Going to start adding minutes to timeout, which will hopefully decrease behavior. Change the World ABA Clinic puts together a reinforcement system for their RBTs. A chart is set up that shows the progress of the RBTs and the rewards the RBTs are able to earn. As the RBTs progress, less reinforcement is given. What type of system is the clinic most likely using? All right, interesting. What do we know about this reinforcement system? Well, we know there's a chart that shows progress and the rewards that RBTs are able to earn. Okay, so to me, first glance, it looks like some sort of economy, right? If we have a progress bar, you have certain rewards you can earn. And as you progress, right, your rewards change, but you get less of them, right? Meaning, as you move up, the rewards might become better, right? But you're getting a lot less reinforcement. You're trying to become more independent. So what type of system are they using? Is this a non-contingent reinforcement system? Well, no, right? If we're using a reward system based on their behavior, okay, it's a reinforcement system, this is not going to be non-contingent, okay? We're not just going to move RBTs up non-contingently, okay? This is clearly trying to change their behavior through reinforcement. So now we have B, C, and D, which all represent token economies. Is this a standard token economy? Well, it's not a standard token economy because we have this progress bar, right? They're able to move up and the rewards change as they move up this ladder, right? Less reinforcement is given. They're moving up and down this progress bar, okay? Is it a token economy without backup reinforcers? Well, a token economy needs backup reinforcers, so hopefully not. And we know you have rewards on the back end, right? So it just isn't, right? That leaves us with C, a token economy with a level system. So in a level system, we have a token economy. As you progress up the levels, less reinforcement is given as we move closer to a more natural style of reinforcement. This is what's happening here, okay? The RBTs progress up this chart, the rewards change that they're able to earn, and less reinforcement is given. So what type of system is the clinic most likely using? C, a token economy with a level system. Look at the graph below. What can we conclude about poor posture behavior? My advice when you get a graph question, before you try to answer it, make sure you understand the graph. The graphs on the test, a lot of times are confusing, okay? You need to understand what you're looking at. So let's not even think about it before we understand the graph. So if we look at it, to me, it looks like a multiple baseline, right? With 3 different behaviors, talk outs, out of seat, poor posture. And as we see, talk outs, out of seat, and poor posture all have the token economy introduced afterwards with the maintenance phase. So which one is the question asking about? The question is asking about poor posture. So let's find poor posture. And as we see in the baseline phase, poor posture is between 10, 15, pretty steadily. Once the token economy is introduced, there's a pretty drastic fall off. And in maintenance, it continues to fall off. So what can we conclude? Well, all I can conclude from that is when the token economy was introduced, what happened? Well, our behavior decreased. Okay. So A, poor posture increased when the token economy was introduced. Well, if we look at poor posture, and when the token economy was introduced, poor posture decreased. It didn't increase. Poor posture decreased when the token economy was introduced. Yes, right? So if we look at it, again, our posture and our baseline is around 9 to 15. We introduce token economy. What happens? Well, poor posture decreases. What about C? Poor posture decreased, and there was definitely a functional relation. So what's wrong with that? Well, you have to be very careful, right? We can't absolutely 100% conclude there was a functional relation without further testing. Okay. What if the poor posture decreasing or improving was a result of the other baselines? Okay. It's hard to say for sure, right? Now, it's pretty close, right? We would in practice say, yeah, I think we're controlling it, but you don't want to say definitely a functional relation. Okay. We don't know 100%. And then D, talk outs decreased when the token economy is introduced. That might be true, but the question is asking about poor posture. So our answer is going to be what? Well, if we look at it, all we know is poor posture decreased when the token economy was introduced. B. 5 minutes elapses and your client says ball, so you deliver a token to the client. 5 more minutes elapses and your client says ball, so you deliver a token to your client. This happens 3 more times. What type of schedule does this most likely represent? Don't overthink this one. You got to be careful here, okay? BCBAs who I work with, or future BCBAs, all want to focus so hard on compound schedules, they forget about the basic schedules. Remember, a compound schedule is just 2 or more basic schedules together. So you need to know basic schedules still. In this case, is this a compound schedule or is it just one basic schedule? Well, it's just a single basic schedule, right? 5 minutes elapses, client says ball, deliver token. 5 minutes elapses, client says ball, deliver token. This happens over and over again. It's a very, very basic schedule. Well, what type of schedule? Is it an alternative schedule? Well, no, an alternative schedule is a compound schedule, and we only have a single schedule, so it can't be a compound schedule. Same with D. Concurrent schedule, or the one that utilizes matching law, needs more than one schedule. We only have a single schedule here. That leaves us with fixed intervals and variable intervals. Well, we know it's an interval schedule, but is it fixed or variable? Well, fixed says it doesn't change. Variable says it's an average. Fixed means it's not changing. Well, we have 5 minutes, 5 minutes, 5 minutes, 5 minutes, 5 minutes. It's never changing, right? Meaning the schedule is fixed interval. Again, don't overthink this question, right? It's a lot easier than it might appear at first glance. My allergies flare up, I clear my throat. When I clear my throat, my infant daughter gets startled. The more I clear my throat, the less it startles my infant daughter. This is considered what? Okay. Ask yourself, is startled a reflex or response? Well, startled is going to be a reflex. And when I clear my throat, I'm introducing that stimuli into the environment, leading to the quote-unquote startled. As I clear my throat, as I introduce the stimuli more and more, startling goes down. This is considered what? Habituation? Yes, habituation is the repeated introduction of a stimuli leading to the decrease in the reflex, right? Typically associated with respondent behavior. Habilitation is just behaviors change to where reinforcement is contacted more. It's not operant extinction because it's reflex, it's respondent, and it's not positive punishment because it's not consequence-based. When my allergies flare up, I clear my throat. When I clear my throat, my infant daughter gets startled. The more I clear my throat, the more I introduce it, the less it happens. This is considered habituation.